Welcome to the Pregnancy Loss Podcast, the place I created for moms like us. Pregnancy loss is all-encompassing and creates an overarching theme that runs through our lives forever. We have to learn to live with and beside the grief of losing our baby. We have to learn how to live again, how to parent again, how to engage and interact and be social again, how to communicate effectively to connect with our spouses and significant others. We have to find who we are now. I'm here to empower and inspire you to live a life even with our unique circumstances. We cannot change what happened, but we can grow and use that strength and resilience to create a life that we love. I'm here to share everything I know about grief, motherhood, loss, marriage, friendship, and parenting. I'm here to encourage you to find the beautiful side of grief, the side where we don't have to isolate ourselves or suppress the need to share stories, the side where you have moms just like you to support and encourage you. The side where we become the best versions of ourselves, not in spite of our loss, but thanks to it. Pregnancy loss is devastating, but it can also be an opportunity to reflect on who we were and who we want to become. So join me every Tuesday for a new episode on the Pregnancy Loss Podcast. Let's jump in. Today on the podcast, we have Karla Levit, founder of Trying to Conceive Coaching. Karla is a certified health and wellness coach with over a decade of experience. She helps women navigate the complexities of child loss and infertility. Her empathic nature, combined with her expertise in fertility coaching and emotional guidance and motherhood support, make her a pillar of hope and healing for her clients. Oh my gosh, I fell in love with Karla. She is such a down-to-earth, just wonderful human. I am so excited for you all to hear this conversation. So let's dive in. Hey mamas, welcome to another episode of the Pregnancy Loss and Motherhood Podcast. I'm so glad you're here today. We have a wonderful guest, Karla. Thank you so much for being here. I'm very excited to continue talking about everything that we talked about the last time we got together. So if you would like to just introduce yourself, let everybody know who you are, what you do.
Yeah, thank you for having me. And I'm excited to be here with you and continue our awesome conversation that we started. We were just vibing from the beginning, so I'm so happy to be back here having this discussion with you. So I'm Karla Levit. I'm a certified health and wellness coach with a focus on pregnancy and conception. And I'm somewhat new to this world. I spent 20 years working in finance in New York City and became really passionate about this work because of my own personal struggles with pregnancy loss and infertility, and recognizing and acknowledging this huge gap between medicine and healing. And I just felt really called to do this work to help women who are struggling on this road, because it often feels very daunting and lonely, and we need more people advocating and doing this work and sharing our stories to help women realize that there are many, many, many people out here struggling, and we need to come together to use our voices, support one another, empower one another, and hopefully cause some change, because we definitely need things to change in the medical community to really, really support women in the way that we deserve and the way that we need.
Yeah. Oh my God, I just love you.
I love you too.
You are so passionate about what you do, and I just love it so much. From my own experience, it was like, I don't know, I was one of those women who it was hard to get pregnant.
Me too.
And so I could never understand somebody's journey who it would never happen. I could, when it seems to be very easy, our train of thought is, oh, have you tried this and this and this, and trying to help, but that's not how we help women work through that. And I don't know, it makes me so sad that this is such a struggle for so many women. And it's another one of the things that we really don't talk about. You hear infertility, but then you hear, stories of IVF and surrogacy, but it's that in between where how do you even get there? And especially if you've had a loss And so you've decided to try another route, to see if that helps. Yeah, I just, what do you think? What is the one thing that you start with your clients? Like when they come to you and they tell you like, either they've had a loss and they want to try something new with infertility or the journey. So like trying new modalities, trying new things to get them to that pregnancy, or where was I going with this? Lost my train of thought, but do you get what I'm saying?
Yeah. I mean, I think it's so hard. I mean, just a little bit about my story. So my husband and I, we got married and we got pregnant right away, like 2 months afterwards. And it was so fast. But then we lost our daughter tragically at 23 weeks. And I gave birth to my daughter, Paloma, still at 23 weeks. I had a placental abruption, which was oh my God, I could never have been prepared for everything that I went through, right?
Yeah.
In the hospital. And we talked about this last time too. And I think, we should spend some time talking about that.
Oh,
because
yeah.
I've been thinking about that a lot since our conversation and all the ways that I could have been better prepared in that moment. All of the things that the doctors and the nurses could have done to support me in that moment, not in that moment, in those days that I was in the hospital. I know that you can relate to that deeply with your own story. But in terms of, clients or women, I hate to say clients, women coming to me for, wanting support. For me, it's really about understanding where they are in the process. Like, so for me, I lost my daughter, Paloma, and then we struggled to get pregnant afterwards. It took 2 years to get pregnant naturally with our daughter, Isabella. And by this time, I was already in that, the medical community likes to label women at 35 geriatric, of advanced maternal age. So high risk, I was literally just bombarded with all those labels. And I was just like, oh my gosh, is there something wrong with me? Like, did I wait too long? And it was just all this pressure and this blame on myself. And I felt like I had done something, and that was speaking to my grief as well, like losing my child. I had blamed myself, even though I know it wasn't my fault and I would have done anything to have her here. I still felt all of that, even if it wasn't outwardly, it was still subconscious and in my heart and my soul and my energy. And so when I struggled to get pregnant afterwards, I felt like it was just another slap in the face. Like, how could I have gone through something so tragic and then something I want so deeply be so hard for me to attain? I was just like, I felt like God, the universe, someone owed me, like they owed me something. Like I should be able to have
I felt that way too.
The kids that I wanted, and I should be able to like get pregnant like that. My husband looks at me and I'm like fucking pregnant. You know what I mean? I was so angry, so angry. And then, I had 3 more miscarriages. They were early. And then my OB, whom I really love and respect, I have to say that I love and respect him. He was like, Karla, we cannot do this anymore. You got to do IVF. It's going to work. It's going to be easy. And so it was sold to me in that way. And I believed him. Because at that moment, and like as women, as people in general, I think, but as women, we are taught to train to just like take what these people in white jackets, the medical community, the doctors say as absolute 100% truth. Okay, he told me it's going to work. It's going to be easy. It's going to work. It's going to be easy. And then I went through the process. And I have to say, like, it from the day one, I felt like it wasn't going to work for me. Like intuitively, and in my body, I just felt like this block there. I walked in to the office. It was literally like a football field space office, with all these women, putting their hopes and their dreams into this process, and it works for a lot of people. I'm not going to speak negatively of IVF or the process or, of people who need that, like it being their only way. But I also want to make sure that women and people that are listening to this podcast realize that it's not a guarantee. It's not a guarantee. Yeah. I feel like we are kind of sold like as an insurance policy, freezing your eggs as an insurance policy, or IVF as, you know, okay, well, you can't get pregnant naturally. Well, do this, it's going to work. And it really takes at least 2 to 3 rounds and at least $30,000, $40,000, $50,000. So it's super expensive and it's inaccessible to most people. And it's also not a guarantee. And even when, and this is just my story, but I want to share it because we had gone through the process and it had been very successful. I had 23 eggs retrieved. I had genetically tested normal embryos, and every transfer, everything that needed to work, or, you know, even like when they're doing this transfer, your lining has to be a certain thickness. It was exactly where it needed to be. And none of the embryos stuck, none of them. And so when my RE called me to tell me that, Karla, okay, you know, I had gone from this model patient to now I'm like a problem patient. He's like, you need a surrogate. Like, how could I have needed a surrogate? Everything was perfect. And now I need a surrogate. So it was just it was
a disconnect.
Me, absolutely. And I felt in that moment, I'm like, wow, he doesn't really care about, like, he cares about his success rates. If I was an easy patient and this had worked, everything would be perfect, but I wasn't, you know, he was going to have to dig in more. We were going to have to do more testing, more work. And he didn't
want to do any more work.
Thank you. He did not. And I sensed that. I sensed it in my heart. And my husband and I had very difficult discussion because at that point, it was a decision whether or not we were going to be able to grow our family because we thought that was our only way and continue down this road, you know, pushing ourselves financially, emotionally, physically. We just knew we couldn't do it anymore. And so we kind of gave that up and decided that we had to go back and just start living our lives, whether or not that meant adding to our family, it could, or it meant just having our one daughter, Isabella, you know? And so when I'm speaking with women who are coming, looking for help, we're really seeing and addressing where they are in that moment. You know, what have they been through? And we get down to the basics, really, because medicine, I've realized, too, they really just only want to treat the symptoms. They don't want to get to the root causes. And most fertility has a root cause. So for me, I was able to realize that energetically and in my body, my levels of cortisol, my stress levels were so high because I was so scared that I was going to lose another baby, that another baby would die. And I didn't think I could handle that, you know? It was so traumatic. And I never really worked through that trauma. I didn't. I ignored it and I just kept pushing forward, you know, just keep going. And I just kept coming up against this wall. And it was like, no, you need to start addressing your pain, your trauma. You have to go and sit in that and feel it and work on it and find forgiveness. Like, I needed to forgive myself. I needed to make peace with that. It's like your body was saying,
we can't do anything.
Exactly.
We're not ready. Yes. We're not ready yet.
Yes. Yeah. And your body will do that. Your body will protect itself. You know, I honestly think that that's what's happening. Like, everything should have worked, Vallen, with IVF, and it didn't, because I was so full of cortisol and so scared. My body was protecting itself, you know? It was protecting itself. No, Karla, you're not ready. You need to do the work. It's miraculous. Yes.
If we would listen. Because I know I not to interrupt you, but I'm just like, if we would listen, but a lot of us, I mean, what I could assume is like, we want that baby so bad that we are willing to go against our body by forcing it to do what we want it to. So the fact that you were able to, like, obviously you're going to continue telling us the story, but listening to yourself, like finding that voice again. Cause I think we've actually lost it in this age of
absolutely.
I don't know what you would call it, medical, you know, in this just world where doctors are up on their pedestals and we bow down to them and do what they want. And we don't even second guess. So yeah.
I feel like it's medical gaslighting because, you know, I had conversations with him, and this is another thing. I think if you're in this position and you're wanting to go into IVF or try, interview your doctors. Yeah. Interview them. There are other doctors. You don't have to pick just, you know, look at your options, and you need to feel supported by this doctor. You need to feel like they're on your team, because it it is too painful and too expensive to not be 100% in it. And so I knew that I did not like this doctor. But again, I didn't listen to myself, and I just went because this is what they told me I should do, so I should do it. And even just little things with this doctor, asking him about supplements, and he was like, well, there's not enough data to support it, so you can do whatever you want to do. And I was just like, I felt so many times like kind of like he was gaslighting me, that you know, my opinion and what I was saying to him didn't have any value. I felt like he was speaking down to me, and I feel like that happens a lot for women, and it needs to stop. We need the exact opposite of that. We need people to listen to us, to believe us, to support us, to empower us. We need the exact opposite of what we're getting right now. And so, I know that a lot of times these stories don't have a happy ending, but mine does. A few months after, and I had been doing the work prior to IVF. I'm talking in my program, I have 3 pillars, and it's prepare your body, prepare your mind, and find community to support you on this journey. And so I had been doing the work prior to this. And when we finally decided that we were not going to continue with IVF, I had been doing different things to heal myself, meditations, affirmations, visualizations, and I had been supporting my body with supplements and the right nutrition, the right foods. And I was able to get pregnant naturally at 41. And I gave birth to my son at 42. So it was a couple months after we stopped IVF, and it was an experiment in destiny, but as an experiment in what I was able to accomplish. When I started to believe in myself, when I started to tune in to my intuition. And so that's really, really what I want to scream from the rooftops too, is like, we are so much more powerful than we give ourselves credit for, Yes, and we need to step into that and reclaim it. I know maybe it sounds corny, but like, it's so true. When I reclaimed my power from that doctor, and I was like, you obviously do not care about me. I am just a number. It kind of lit a fire in me. I was like, okay, I'm not going to prove you wrong, because I didn't know what was going to happen. And I've kind of like secretly wanted to call him and like, listen, asshole, I got pregnant naturally a couple months afterwards. Like, so I didn't need a surrogate, but I'm just so happy with how things have turned out. And, a lot of people want to say, oh, he's your miracle baby. And I'm like, no, he's my magic baby, because I did a lot of work to call that baby down, and he's here and he's perfect. And it's magic, but it's an experiment with destiny, an experiment with what energy can do, what healing can do, what you can do when you have the right support, and when people are helping to support you and helping to empower you. We feel like when we're going through infertility and pregnancy loss, like it's so much blame that you put on yourself, that you did something wrong, or that your body let you down. And there's a lot of like shame surrounding that.
Hatred towards your body.
I couldn't look in the mirror for such a long time. When I was going through infertility, I would take these pregnancy tests every single cycle, and I would like hide like in the bathroom and do it like really early before anyone was awake, so that I could deal with my own shame alone, and it breaks my heart, like looking back, thinking about all the things that I went through, feeling so alone. And so that's why I'm just like, we need, as women, we need to start talking about this, sharing our story, and helping people to feel like they're not alone, because together, our collective voices, we can do something to change this. We can't keep going this way. Something needs to change.
I know. I think this conversation is beyond pregnancy loss and infertility. It's like womanhood. I'm just resonating with all of this, sitting here with goosebumps, and I'm just like, yes. We're all woo-woo here. But I'm like, the whole medical practice and all of they feed off of our shame. And
I think so.
The fact that we're like, I don't want to say all male doctors are bad, like in the fertility field. They're not.
No.
But this is a place for women and empowering women. And I feel like because my doctor, the doctor who told me that my baby had died, was a man.
Yeah.
The man who would not listen to me. He did not give me my C-section. He had the midwife coerce me into giving birth vaginally. Like, I have a very sour, taste in my mouth when it comes to male doctors in the fertility field, from my experience.
Yeah.
I feel safer with women, even as doctors. Oh my God, my brain this morning. But anyways, so everything that you just said, I find, regardless of infertility, regardless of pregnancy loss, healing starts when you are able to empower yourself and able to look inwards and start there. But we're so disconnected. Like, I'm 35 and I am just now realizing my power and realizing that I can curate my life and I can actually decide how my life is going to go and I can make it how I want it to be. And I have terrible arthritis in my knee. I know this sounds like it's not even connected, but follow me. And I had to get an MRI recently. I went to this knee doctor, never met him before. I spent less than 5 minutes. This guy came in, looked at my knee, gave me some steroids, and then I left, and then I got my MRI. And so it's advanced arthritis. I have arthritis of a 7-year-old in my knees. I am a high school athlete. I played basketball for 10 years of my life. So I knew that already. And guess what the treatment was? The treatment plan is a total knee replacement.
Oh my God.
A total knee replacement at 35. Yeah. And then other than that, it's treating symptoms instead of fixing the problem. And the point of this being is that I know in my heart that I can fix this if I'm able to do the work. Now, that includes the work that I'm already doing. I have a fitness and nutrition coach. I've lost 20 pounds in the last 2 months working with her, slowly, easily. And I can already tell the difference in my knees, losing 10 pounds. What was it? Sorry, I'm terrible with numbers, but the research that I did, losing 10 pounds relieves 40 pounds of pressure off your knees. And I know that over the course of the last 10 years in motherhood and my grief and all the childhood trauma that I carried with me, and I gained 100 pounds. Yeah. I mean, since 2008, I've gained 100 pounds. That's significant, but that also tells, if anybody wanted, if somebody was really trying to help me, they would see, okay, there's something else going on. It's not about your weight. It's not about the food necessarily. There's something deeper.
Yes.
And that's how I'm trying to connect this all. But there is something deeper that I have to fix. And so that is the journey that I'm on, because I know, regardless of what the doctor told me, I refuse to take that as I need surgery or I'm going to be on pain meds the rest of my life just to treat the pain. And I know it's not true. And so I'm finally believing myself and okay, nope. And this is lit a fire for me because I refuse to have a total knee replacement. I haven't heard anything good come of total knee replacements, especially early. I am young.
No.
There's no reason to do that. But that's the point that, the medical field pushing either treatment. So crazy treatments, jumping from not being able to get pregnant to IVF, which is a significant financial and physical burden on these moms. And then jumping from, oh, that's not working, even though your body is in perfect condition, to now you need a surrogate. You're no longer able to carry, adding more shame, all of these things. But there's these spaces in between that are not being looked at. And, so it's just wild.
Yeah.
And so that's what I think you're doing. You're going in between. You're looking at the deeper part as a coach and from your own experience. And it's your body was perfect. Like you said, like your conditions were ready. It wasn't about that though.
Yeah, I know. And it is all interconnected. You know, your story about your knee is connected to what happened with me in fertility, because it's like they never want to go deeper, ever. You know, they want to spend limited time with you and just push you into these treatments or surgery or these costly, interventions without really taking the time to really see what is going on, not the symptoms, the root cause, and see the little bit of work. That's not a little bit. I'm sorry. That's a lot of work to lose. Yeah.
That's why they don't want to do it.
Yeah, exactly. And it takes a little bit. It takes more time. It takes more time that they do not want to give to their patients. I mean, literally, like I said, when I walked into this IVF clinic in New York City, it was like the size of a football field, and it was packed, and it is like a well-oiled machine. You're in there for 5 minutes, you're into the ultrasound room, and then you're in taking blood, and then you're out. Boom, 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 boom. This is what it's come to. Yes.
Yeah, women are a big money machine because our bodies do this amazing magical thing. And
I know. I think we're just really all taken advantage of, and we're really it's a lot of gaslighting, honestly. And it's, but people are starting to wake up. People are starting to wake up and understand that, like what you felt like your doctor said you needed. So you're like, there's no way I can do that. There's no way. When my RE told me you need a surrogate, there's no way I was going to do that. No way. First of all, I could never afford that. A surrogacy is like $50,000. Like, no, I think it's way more.
Even more than that.
Yeah. I mean, how do they expect people to actually pay for this? You're telling me there's nothing in between. So that's two. There's so many people who can't even afford IVF, that are left feeling so hopeless, And if you weren't strong enough to say within yourself, okay, that's his recommendation, but in my heart, in my soul, I don't believe that to be true. I'm going to take initiative and start trying to figure this out on my own. There are a lot of people who don't feel empowered to do that, or feel very lost and don't have the support to do that. And so that's really where I come in as well. But it's hard in these, to help people in these areas, because a lot of people just want a doctor because they kind of want an easy fix. It's like, and a lot of times you do have to do the work, and nobody's gonna fix you. This is why I say, like, be your own hero. Be your own hero. Step up. You can do it. And there is support out there to help you, because you're not alone. Like, you have someone, your nutritionist, who's supporting you now, and look at what you've accomplished. And you're going to keep working together and accomplishing more, and you're not going to need that surgery because you said you're 35 years old, And for me at 41, when I was going through this process, I was already, of, advanced maternal age, high risk.
That label.
Geriatric. I hate geriatric is the worst one ever. I really they have to do something about that. It drives me bananas. Like, I want to scream when I hear that fucking word. It drives me nuts.
All of these limitations that have been placed on us are placed on us by, I hate saying the patriarchy, but our male dominated world.
Exactly.
And anybody listening, one, I want to say that we don't hate doctors just because this isn't about not liking doctors. This isn't about not liking men. Like, this is it's bigger than that. And it's like hundreds of years of oppression, just on women alone. And because this stems way further than us. And again, my brain, we were going somewhere with this. I didn't take my medicine this morning.
But I agree.
Oh my God.
And again, for your listeners, I respect doctors. We are talking about working together with doctors, but we are talking also about stepping up and doing the work that needs to be done from yourself. Because no one's gonna help. No one's going to fix you. You can only fix yourself. And your healing starts when you're ready. You have to be ready to do this work. But what we're saying is that you can do this work and that you don't have to feel like whatever the medical community is saying to you is your only option. Because more times than not, there are other options. And you just need to open your eyes to that and be open to that. Just be open to other possibilities, you know?
Yeah. Thank you. Yes, you saved me and got me back on track. 100%. Okay. And I think one of the bigger issues is that maybe it's like our generation, but I was never taught like anything about being a woman. I was never taught how to advocate for myself. I was never taught what adulthood looks like and, you know, how to I wasn't prepared like for life at all. Like, I mean, if 10 years ago, I wouldn't be like, I could never be who I am now. Like there are so many things that I had to go through. Yeah. And which is the hard part because the people who maybe are a few steps back from us aren't there yet. Right. So like, how do we get them there? You know, how do we, I mean, and I think that starts with having these conversations where we can say, you don't have to just do what you've been told your whole life. You don't have to just, you know, I was always, you know, told that the doctors, my family hated doctors. Anything that the doctors told them was, nope, that's not true. That's stupid. They don't know what they're talking about. Like wild. Okay. And my family, unfortunately, they were bigots and racists and just awful people, mental health issues, everything undiagnosed because nothing was possibly wrong with them. So that's where I grew up. So I grew up like second guessing all the time. But then once I got on my own and those are the only people that I had were the doctors when I got sick or that's where I went. And that's what I started trusting. I no longer I didn't trust them anymore and they're crazy and they don't know what they're talking about. Now I 100% trust them. I'll do whatever they tell me because there was no other option. Yeah. There was no, I don't know, healing coach. There was no, you know, anything woo was crazy, like witchy, like truly. And it's like that stuff is where we began. Yeah. We began healing with dandelions and shit out of the earth. Like my daughter the other day, she's like, Mom, we got to go, you know, get rid of those. I'm like, no, like it's just like these things that we've been taught and even passed down subconsciously or in our genes, in our genetics and all of this stuff that is like taking us away from the earth, taking us away from our power because we are powerful and they're terrified of that. Literally women they will one day take over the world. We will take it back, I should say, and not to oppress men. That's not the point. But the point is like, we can heal. Like we create humans. Like, I mean, it's magic. Like this whole fucking world is magical. And everything's just been industrialized, you know, the Industrial Revolution. That is probably where this all started. You know, women getting these surgeries, women laying on their backs to give birth, like plug and play, get it done, in and out, as much money as we can make. Like that's where we're at. But that's also where, like you said earlier, it's starting to end. Like women are starting to wake up. Like, as I'm on Instagram and I see these women coaches, these women like being truly authentic to who they are, like it's, you know, people make fun of it, but like women, you know, dancing around in the woods and like talking about how magical this world is and like really, really just being in their power. I'm like awestruck by it. And I'm like, oh my God, I resonate with that. Maybe that's where I should be. And so it's just, helping women find their source of power and realizing that, doctors are a great tool, when you break a bone and you need a cast and things like that. But when it comes to like infertility and things, I think we need a more holistic approach to it, which is what you do, and healing the body, not treating the symptom, not throwing, like my last pregnancy, I have never had thyroid issues my entire life. And this pregnancy, my numbers, it was like 2.9. So it was like right over the line of normal. And so I was given thyroid meds and I didn't notice like a big change or anything, but I shouldn't have had to take them in the first place. I didn't know to advocate for myself because I thought something was wrong because they told me. But I don't read numbers. I don't know what these acronyms are on this piece of paper telling me. I don't know how to do that type of thing. So that's, again, where that trust with our medical providers and just doing what they tell us. Now, when I had the baby, when I had Bodhi, I didn't know what to do after that. Nobody gave me any guidance on this medication and what I should be doing. Nobody gave me any more. I didn't have any more. And I gained 23 pounds in 3 weeks.
Oh my goodness.
From not taking this medication. I didn't know it was wrong. Like, I like blew up. It was like so quick. It was crazy.
That's
and
wild.
So it's like that continuation of care as well. Like nobody thought, like what? Nobody's reading my file. Nobody's being like, okay, these are the medications you're on. Oh, you're on this for the pregnancy. We're going to have to wean you off that, or how, I don't know what they do, but the fact is that I shouldn't have needed it in the first place. And the fact that they didn't even check up on me after and they just kind of let me go, that's where we struggle too, because oftentimes, okay, here, take this for your pain. You're off on your own. Oh, have a baby. We'll see you in 6 weeks. Like even after you lose a fucking baby.
I was going to say that.
After
Where
you
is the
lose a
support
goddamn
there?
baby.
Yeah.
Oh, we'll see you at your 6-week checkup.
Yeah.
But when that baby is born healthy, day 1, day 3, they make it completely fucking inconvenient for you.
Yeah.
Like purposely, because, oh my God, this baby might die if they don't, have us weigh them. Like if there's serious issues and complications with the baby, that is when we do this extra stuff. But literally we went 9 months taking care of this baby on our own. He or she doesn't need to be weighed every day, doesn't need his fucking head measured every day. Like there's a lot of wild things in this fertility pregnancy, postpartum. And it's like, pregnancy, and then as soon as we give birth, that's it. It's like, okay, you've given us another human to inherit this world. You're worthless now. That's seriously.
And the thing is that I don't think anything's changed. How can everything in life change and be up? Look at the technology, how much it's changed in such a short time. And why are we treating women in maternal health the same way we've been treating them for decades? I mean, how does that make any sense? And, you're right. What you were saying before, women are not educated on our own bodies and how they work as well. We when we ask questions, at least from my experience, the responses I've gotten have been very technical terms and not easy to understand. And so you're kind of left wondering, well, what does that really mean? And there has to be more personal care. There has to be. Things have to change. And as women, we need to ask more questions too. And I think that the only way this is going to change is if we all come together. Because, and again, we're not men. I mean, we both have sons, like husbands that we love. It's not about men. It's about how women have been treated for far too long.
That was created by men,
for men. Yep. So we weren't really meant to kind of, raise our voices, but things have gotten to a point where we just don't have any other choices,
Yeah.
in pre-care and preconception, in pregnancy and aftercare, postpartum, in all of ways that women's bodies are viewed as too complex, or not enough studies. I just saw recently someone posted about a women's study recently done on how much sleep we should get as women. It's always been, the research is always done on men. Well, men's bodies are different from women's bodies. So it's the conclusion was different. We actually need 1 more hour extra of sleep, something like that. How is it in 2020? And it's mind blowing. But that's the thing. I think that, the powers that be like to keep us in line. Just do what we say and everything will be fine. Well, no, that doesn't work anymore. It doesn't operate anymore, especially when you come up against really huge obstacles, like both of us have lost babies in very traumatic ways that has really just altered our life and our path, right?
Yeah.
Because what happened to us, we don't want to happen to anybody else. And so that's why we are here advocating and sharing our story and raising our voices so that this doesn't happen to another woman, because things have to change. That's what it's really about. It's not about saying that we don't trust in doctors or we don't like them. No, we work in unison with them. But what we're saying is that we have to take an active role in our health, in our wellness, so that the medical community responds appropriately, and that we work hand in hand now. Now it's not just about the doctors telling us what we need to do and we just taking it, at face value. No, we're going to do our own research. We're going to advocate for ourselves. And if we don't feel like we're in line with what our doctor's saying, then we're going to look for somebody else, and we're going to do our research. Now technology, makes so much research available. And you have to be careful about, what you listen to and what you find on the internet. Absolutely. But at least there's more access to information so that we can educate ourselves and have, just feel more secure in what we're going to, whatever path we choose, like in IVF, for example, I know so many women who it's worked for. It works for many, 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 many women. But what I'm saying is it doesn't work for everyone, and not everyone can afford that. So there are spaces in between, and nobody wants to talk about the spaces in between because, well, that's just not the way it is. Well, the way it is needs to change. And that's what we're saying. Because the way it is not working. It's not working.
Yeah. And when it comes to fertility, it's not a one size fits all. Like our medical practices typically are. Okay, this is wrong. This is what we do.
Yes.
It does not work like that.
No. And that's really how they want to treat you. They have pretty much like a one plan fits all.
They do.
Yeah. And unfortunately that doesn't work for a lot of women because our bodies are so complex. And they're ever changing, they take these fertility labs and, a lot of these indicator numbers like your egg reserve, or other indicators, they'll change within cycles,
Okay.
And so we need to adapt to that as well. And your doctor is not going to do that for you. You need to take ownership in that. And so there are a lot of ways where we can take our power back. We can take initiative. We become the driver in the car, We are in control as much as we possibly can, because the most difficult thing about infertility too is feeling so out of control because you really don't know what's going to happen. It's all chance. But you can certainly do, different things to improve your chances to have success, and when I decided that IVF wasn't going to be our path forward, I didn't give up. And neither should any of these women that have not had success. You don't have to give up. The only person that's going to tell you that you've come to the end of the road is you and your partner. And when you feel like you've come to the end of the road, because my message to you is don't give up hope. Yeah. Don't give up hope.
I feel too, a lot of the women who, there's a lot of focus on the physical body. That's the only thing that is considered when, you're not able to get pregnant, or they want to send you to get fertility treatments, or they want to get you a surrogate. The only thing they're looking at is your physical body, your size, your blood count, your, all the numbers that they get from blood tests and those things. And when that's not working, that right there tells you that is probably not the problem, unless it's on paper it says like, you don't have eggs, or I don't know exactly how that works, but it's not the problem probably at that point. It's internal. It's something you don't see. It's the trauma that you've experienced. It's the neglect that you've experienced as a child, or, if you are somebody who's experienced domestic violence, or somebody who, there's so many things that go into having a baby. And you were talking about your stress level. You can't see that, but your body feels it, and your body knows what's going on. You can't see your mental health, your emotional health. Just, there's so many things that I feel like have to be right before you can get pregnant. And those are the parts that we don't talk about. Those are the parts, because doctors can't diagnose that. They don't know your past other than what you've told them. And there could be something significant that they didn't ask you about, that you didn't tell them about, that doesn't fit in the box. It's just a lot. It's a lot.
Yeah, no, you're 100% right. And I honestly can say, yes, doctors just want to treat your, your body, your reproductive organs. But like you said, it goes so much more than that. And honestly, I believe your emotional health is just as equally, if not more important than your reproductive organs and how they're functioning. And just for an example, in my situation, after we lost our daughter, Paloma, when I got pregnant 2 years afterwards, I literally would have these PTSD episodes. Like, there were times where when I was walking into the doctor's office, I couldn't feel my legs because I was so scared that something was going to happen, right? And that my blood pressure was so high that my doctor would say, Karla, you need to do something about this because this is not good for you or the baby. Okay, well, understood. I understand. Yes, I have to do something, but there was never extra support. Like, well, what kind of support?
What is that?
Yeah. No, it was you need to do this. And it was like a 2-second conversation, and then like off you go. Okay? Your blood pressure is way too high. You need to address that. That's not good for you and the baby. Well, no shit, it's not. But you know what happened to me in my past. You know that I'm trying to deal with that. But how can you, as my doctor, support me in that way? There's just such a gaping hole between medicine and healing.
Was this the same doctor or same office and same place where you went with when you were pregnant with Paloma? And
yeah.
And the same doctor that knew your story?
Yeah.
And so they weren't even it's like they're not cognizant of that in that moment, or they didn't go over your file before you came in, or
oh god, yeah. How many times does that happen? After all the losses I've had, every single time, every single doctor opened the file, they ask you the same questions. That's something else that this care needs to change. Like, how many pregnancies, how many losses? It's like
there's no compassion in this space.
Yes, there's no compassion. And when I had all these losses and the loss of my daughter, do you know what they said? Bad luck. Bad luck.
I remember you telling me that.
Bad luck. Bad luck. That is just a horrible thing to say. That is not bad luck. That was my child.
Yep.
And they want to rattle off statistics.
Yep.
That means nothing to me. Statistics mean nothing to me when I'm, when I'm dealing with all the pain and the trauma that I just went through, and then to have subsequent miscarriages as well. I think it was too much for my body to handle, and studies prove that, stress hormones are in, direct competitions with the reproductive hormones that need to create a pregnancy and carry a pregnancy. You know, it takes so much energy for your body to create a pregnancy and then to hold it, you know, for 9 months. It takes a lot. And, you know, certainly there are women out there who can get pregnant with no problems, no issues. But there are a lot of women out there now. The World Health Organization has updated, you know, their statistics. Now 1 in 6 women will suffer through infertility, you know?
Wow.
That's a lot of people out there suffering, you know? And we need to think about why it is, and then also how we support these people out there. Because we just know that the medical community, as is right now, is just not doing a good job about it. Certainly not.
There's a disconnect. There is.
Yes.
People, I feel like, especially in this field, we need the providers that are 100% gung-ho on love and compassion and support. And just, I mean, I felt that a lot with my midwives. So like with the practice that I was at for my loss, and then part of my rainbow baby, it was a doctor. I mean, it was, you know, Providence Medical Center. But the office was comprised of OBs and midwives. So I saw the midwives because I didn't have any problems. Like when I was pregnant with Evelyn, right? So I don't need to see MFM. I don't need to see any specialty doctors or an OB at all. So my experience, I mean, midwives are the closest thing that we have to that compassionate care that we really need. Most of them are women, so they understand the journey, especially if they're mothers themselves and they've gone through it, and they've had losses, they've supported losses, like they've seen it. And then the care that I received when I was pregnant with my rainbow baby from the same place, from my midwives, was amazing. Like they knew what I had gone through. They checked in on me like every time I had to come in there, and they offered me to go to a different office to be seen if I didn't want to come into that one. I had really great care in that way, luckily, because I know it doesn't happen for everybody, but I don't know. I think midwives need to take over again.
It's funny that you say that, because, you know what, Vallen, I 100% agree with you, because when I got pregnant again at 41, I thought, well, I should go back to my OB. And then I was like, no, I'm going to try something different. And I went to a midwives. And I agree with your experience. I had the most beautiful experience. It was totally different. And yes, they were all women. And even just the ultrasounds, the care that I was given during the ultrasounds, because they knew of my past, the way that the ultrasound technician would speak to me and let me know that everything was okay, the care, the empathy, the compassion. And I felt so much more relaxed and more taken care of and more supported. And I had the most beautiful pregnancy at 41.
Which promotes that beautiful pregnancy.
Yes. And then I gave birth, and it was like, you know, they were like singing, talking, like it was a beautiful birth.
I'm so glad.
I can't speak, like my experience was amazing and beautiful with midwives, and I would certainly recommend midwives to any of your listeners out there. Like 2 of us now, after a traumatic loss, had a beautiful experience with midwives. Mm-hmm. Yeah.
Oh my God, I love them so much. Even my midwife, Gretchen is her name, is the midwife that delivered Evelyn, and always was there for my follow-ups. She was like the one, she would make sure that I was on her schedule. Like as soon as, cause she came in, so I'm in labor with Evelyn, and shift change is at 7 a.m. She came in to this terrible experience. This poor woman, she's thrown in here. We had a full term loss. Like, it's your turn. Just came in. She hugged me, cried with me, asked me what I wanted. She's like, give her all the drugs she needs. Like, whatever she wants, you give her. Don't second guess her. Like, just made everything happen. And so there are providers that I will just never forget, and that made me feel like a human. They didn't, they weren't trying to rush me out of that goddamn room. They were they were holding me and hugging me, and my nurses too. Like, yeah, that just reminded me. I just wanted to share that, but
no, it reminded me of when I gave birth to my son as well. Of course, I had a lot of fear and trauma, but she made me feel so comfortable. She made me feel safe. That was so important. I felt safe. And then her energy and how she was leading that experience, you know, it just like took over the room. And the nurses there too, they stayed past their shifts because they wanted to see my son being born, you know, and that matters. That's amazing. Like that experience I will carry with me for the rest of my life, and knowing my history and how she was able to really support me in that moment and make me feel safe, because, you know, at any moment anything can go wrong. Yes. And she changed like my life in that moment, the way she supported me. Isn't that what it's about? You know, supporting women in that way, that they have this most wonderful experience of bringing another human into this world, and they helped you through it in a way that like you will always remember and think of warmly and fondly. You know, I just think that we need more of that. We need more of it. But I know that I will tell you something funny.
Yeah.
My husband, I told him I was going to midwives. He knew this, but when I was getting ready to give birth, the midwife, you know, opened up her, I don't know what you would call it, but her tools. And my husband's like, "Where's the doctor?" And she's like, "I'm delivering your baby." You know, it's like, he was like, "Oh, okay." You know, and he was like, a little like, "Where's the doctor?" And I think that's too, like, a lot of us think that, like, where's the doctor? No, these women, this
is not a surgery.
Yeah, exactly. They are more than capable and able.
It's what they're trained for.
Exactly. And what a beautiful experience it was, you know? But this is the thing too. We need to like start talking about it and making it more, not more acceptable, but like take away maybe the
maybe give the choice. It's, you know, because there was something so beautifully said about pregnancy and like delivering the baby, but like in regards to like people thinking that you need a doctor to deliver a baby, this is not a scary thing that's happening. This is one of the most natural things in the world. And there, you know, it's like, it's not rocket science. It's literally something that we used to do for each other, like as neighbors. It's not this problem that needs to be solved. It's a celebration, and it shouldn't be scary, and it shouldn't feel scary. It shouldn't feel surgical. No, unless there's a significant problem, those are the women that need that hospital and need those interventions. But, I just, what did your, my husband would have done that too. If she, like, my midwife didn't have any tools, but
that's what we've been taught, right? You need a doctor. You're in the hospital, you need a doctor. Where's the doctor? Where's the OB? You know? No. But see, that's what we're taught too. Like even me going to a midwife, you know, people were like, "Are you sure?"
I know. It was one of those things like,
it's like this preconceived, I don't know. It's not that it's looked down upon, but it's like, why wouldn't you go to a doctor? And it's like, but these women are trained to do this as well. And like, it's again, Vallen, going back to the basics. Yeah. But going back to like how this was supposed to be. It's like a return to the way things were before everything became like this surgical, industrial, complex moneymaker, profit over patient system that we're in now, you know?
Oh my God. We need, I discovered this thing. You'll have to look it up. It's called the Rainbow Clinic. And I think it's in the UK, but it's literally, it's for women who have lost babies, gone through traumatic birth. And it's like this special, I don't know if you would call it a birth center or what, but all the specialty care. And I want to open one so fucking bad. I don't know how.
Oh my God, that would be amazing.
But I'm like, I want this space for these women who need that extra care and who are actually willing to have that extra care, you know, that aren't scared of getting the support from outside of the medical community. Cause there's doctors at the Rainbow Clinic, obviously, but you look it up.
That would be a beautiful thing. Yeah. And did you see that? Like I'm not on TikTok or anything, but there was that viral woman, like a younger woman who had to wait in the waiting room. She had just had a miscarriage.
I heard about it.
It's things like that too. Like, I remember having to go into the doctor's office, waiting with all those pregnant women, like trying to hold in my tears, like trying to be strong, putting on that strong face, like literally pinching my arm so I wouldn't cry, seeing all these pregnant women, you know, and after losing my child, like, why couldn't I have come like the first patient or the last patient, or had another day, you know, where I didn't have to go through all this, you know, or had, I don't know, more
exactly.
support,
There's
support.
Not, it's like these things, I feel like, hospital administrators and all these people think that the things that we need are expensive and extravagant. And all we fucking need is for somebody to remember that we have gone through this thing, and to just put us in a separate room. Yeah. To put a hand on our arm and remind us that they know what we've gone through. Like, we're sorry that you're here. Yeah. We made up this room so you don't have to be here outside with the pregnant women, or we don't need anything other than compassionate fucking workers, compassionate people who will read the goddamn file, you know, with an alert on it that says she just lost her baby. You know, give her special treatment. She deserves special treatment. Like, oh my God. Luckily for me, I was taken, like Gretchen, my midwife, as soon as I came in for my 6 week, they took me to a room. They knew, and it was at the end of the day. They, you know, I was her last patient. But the thing that they didn't think of was the fact that there was a mom next door having an ultrasound. And they were doing the heartbeat, and I could fucking hear it vibrating through the wall. Yeah. And that's when I broke down. So we don't need extravagant things. Give us a goddamn soundproof room. Like, make one special room. You already have the room. Sorry. Actually, you can just make it comfortable for us. Yeah. And make sure to put us there as soon as we get there, by having your workers actually read and do their due diligence. You know, they're putting this paper packet together for us to sign. It should have something on the file. Yeah. We don't need extravagant, you know, financial contributions to support our lost community. And that's what makes me so mad. It's like, we just need support.
Yeah. It's really very simple, but it would take people having to make changes. And like anything else, you know, there's not enough people demanding change, and there's not enough doctors and medical community who want to change. You know, they go about it the way they've been going about it. You know, they're stuck in their dogmas.
It's easier to do that.
Their ways, absolutely. But, you know, I think things are absolutely changing, and people are waking up to this. People are wanting different experiences. People are understanding that, you know, it doesn't have to be this way. Yeah. And so I think things are changing, and I think people are exploring different ways of healing too. Like, for me, when I lost Paloma, I went on this retreat with my friend. It was just like a yoga retreat, and it was actually deeply healing, because it was the first time that I kind of felt like myself again. You know, I got out of the house again. I was like in a different place and a destination. I was, you know, having these moments of like, feeling alive again, you know, because when she died, I mean, I felt like certainly a part of me died that day with her, but that I felt that I didn't know how my life would continue. And so the thing that, you know, really helped me is what I'm trying to recreate right now with the retreat that I'm hosting in July for women who are suffering through pregnancy loss and infertility. You know, I also recently, I'm got certified level 1 Reiki, but I'm going for level 2. And so I'm going to be practicing maternal Reiki. Yeah. And I'm going to be holding a session, in Costa Rica. All the details are on the link I shared with you. Yeah. We're going to be doing Reiki. We're going to be doing yoga. We're going to, be doing a cathartic writing session. We have sound bath and a cacao ceremony.
Oh my God.
Yeah, we're going to come together and support one another and experience different modalities. You know, it's like a return to self. Return back to who you are, because I know that when you're on this journey, it's easy to forget who you are, but that's where you start. That is where you start. So we're going to come together. We're going to heal together. We're going to experience this together. We're going to lean on each other. We're going to share our stories, and we're going to do it where the jungle meets the beach. And I've been to Costa Rica a few times. We're going to do a waterfall tour. We're going to do surfing. It's going to be something really, really amazing. And I'm
oh
so
my God,
honored.
I want to be there.
I know, I'm so honored to host it, but I'm also so honored to kind of be there as a participant as well. So I'm really looking forward to this. Yeah.
That is so cool. I am so happy for you. So proud of you.
Thank you. Thank you.
Where can everybody, we're going to wrap this up. Where can everybody find you? Where are you at mostly?
Mostly on Instagram, sharing my story, and then registration is open for the retreat. If you have a desire to give yourself a break and maybe learn how to heal, and maybe want to feel supported with other women who understand your journey, join us in Costa Rica. I've given you the link.
Yeah. Okay. I'll put that it'll be in the show notes. So you guys can find it. You can find her website and her Instagram handle. And
if you have any questions, DM me. I'm open, and I'm wanting to help because I know that there is a need. And thank you so much, Vallen, for having me on. I really love
Oh my God, thank you so much for being here.
Conversations.
Yes. Okay. We'll talk soon.
All right. Have a great week.
You too.
All right.
Thank you so much for listening to the Pregnancy Loss Podcast. I hope you enjoyed the episode. I created a guide on 20 ways to celebrate your angel baby. It gives you 20 amazing ways to celebrate their birthdays or ways to just remember them on any given day. If you want to download it, head over to vallenweb.com/resources and click the link. I hope you guys have a great week. See you next time.